We'll be holding the caseload estimate open, colleagues. And I would like to make a recommendation that we do adopt the placeholder trailer bill language to eliminate non-emergency room copay. Okay, Mr. Monning is in support. And that will have a 2-1 recommendation. Thank you very much. All right, we'll move to Cal Here's Oversight, page 20 of the agenda.
Thank you. I wanted to also make sure that Renee Malo from our department, as well as John Boulay from Office of Systems Integration, I wanted to make sure that we had all the full CalHERS experts at the table, and I know Yolanda Richardson from Covered California is here as well. Off the bat, I wanted to acknowledge the work of the staff, both at a state and a county level, that over the last few years have been working together to get the system up, and then also to the extent that CalHERS, when it became operational, was far from perfect. It certainly accomplished a lot, but it certainly also did not finish all of the different functionalities that we all would have liked to have seen. And so, to the extent that it's an immature system that is still finding its way, we want to ensure, both for you as well as the users and the beneficiaries, that we endeavor to make sure that we are clear in our priorities for how we're designing the functionality of the system, how are we testing it with the county systems, as well as making sure that people have appropriate time to test and to do the training down on the ground level. Because obviously, if we're doing 1 million redeterminations and we have open enrollments and we have just this continuing workload, I think it's in all of our interests that we have a system that works well for all users. In the agenda, it's asked for us to talk about the governance structure of CalHERS and how the criteria the project sponsors use in establishing the release schedule. I think first and foremost, when we talk about developing the functionality and developing the release schedule, otherwise known as the 24-month roadmap, we look at a variety of factors when we're looking at these various releases. Obviously, first and foremost is we need to make sure that the system is doing what is legally required, either by federal or state law or regulations. We keep a keen eye towards the cost. Not only are we building it from the state perspective, but there's also costs within the counties as they do various programming changes, and there's obviously workarounds. And so, to the extent that we can make as much automated as possible, it makes it much easier on the staff down on the county level so that there's not these workarounds. But cost, in terms of how we build it, matters. Ultimately, I think the success of the system is going to be based off of the operational risk that we calculate when we do these designs. I think some of the things that did not work in 2014, and I think that John can speak more to this from a technical perspective, were that we pushed the time frames very aggressively, and that there was not enough time to actually test it. So, the problem is that once you are testing while you are actually using, those are not actually the best times to find out that that a piece of the system is not talking to another piece. And so operational risk is something that we try to take into account when we do the release schedule. And then lastly, and I know this is something that's important to you, is the end user satisfaction. So to the fact that there's a beneficiary on the other end using the system or working with an eligibility worker to use the system, it is of utmost importance to all of us that it be as seamless as possible and not have any kind of barriers or glitches that require another set of steps that otherwise should not have to be made. And so that's our overall goals when we look at how we develop the schedule and the functionality. More specifically to the governance, I, along with Peter Lee at Covered California, are the executive committee, and John obviously advises and works with both of us. And so to the extent that there are issues that need to be made or decisions that need to be made, we both are jointly advised, obviously by several staff and key individuals, including the project director. To the extent that we are contemplating changes as the system continues to mature, I believe that the project director for the project under CalHERS will be reporting directly to John at Office of Systems Integration, and so that there's going to be a unified project team in place that he will obviously be in charge of. So I don't know if there's anything additional that you would like to make on that. No. Any questions?
I would just say that based on legislation that I've carried previously and our conversations around my priorities, I appreciate the efforts around the 24-month clock, 24-month, do you call it?
Roadmap.
Roadmap.
If it's a clock, we're in trouble.
Same. The roadmap, the road to seamless access to healthcare. And continuing to inform the legislature on the progress you're making on the roadmap, just so we're clear as we respond to advocates and constituents primarily. I appreciate the attention to foster care, youth, as well as women in the AIM program in terms of those workarounds. Building a system of this size and magnitude is an overwhelming task. And I think continuing to have advocates engaged, as the Director of Department of Managed Care talked about, particularly in these systems where advocates in many instances represent folks who are on the ground, who are using the tools, will continue to make it a better product. So I would encourage you to do that.
Right. Thank you. Did you want, I can talk a little bit more to the CalHERS, or are you good?
Why don't we let you go ahead and answer the questions posed, so as folks queue up for public comment, why don't we do all of CalHERS? So we'll do the oversight, you answer the questions, and we'll turn into, and we'll roll right into MAGI determination trailer bill language.
Correct.
So as folks queue up, we can have a full CalHERS conversation.
Perfect.
Fair enough?
Great. That's perfect. So I think, as you noted, the lessons learned in 2014 are applying to us in 2015, and that it was a extremely compressed time frame that didn't allow for a lot of testing, and otherwise the discussions and deliberations that if you had a much longer lead out, it would have, I think, led to a lot better result. I think that what we did in developing the 24 roadmap was to try to both explain very clearly for individuals outside the stakeholders to see what we had planned, and then obviously that priority list is governed by the county systems that also have their own programming needs. For example, LEADER is undergoing a complete redesign, and so there's going to be opportunities in which they have to take advantage of their time down to make the system changes that they have to make. And so the programming that we had to move around is the complexity of those systems, and so we're mindful of that. Now that we have released a 24-month roadmap and heard back from stakeholders about some of the things that we had in place, we obviously listened on the foster youth and on the AIM. Those are populations that, yet small, are very difficult to capture, and so I think that's why we did that. And while we are working on those releases, we have developed a series of either pop-ups on the screens or additional flyers or other outreach efforts to try to capture those, especially for the foster youth. I think that there are a variety of different communication mechanisms that we are continuing to work with stakeholders and county individuals with. We have the AB 1296 work group, which meets every other month. We have an AIM and newly qualified immigrants work group. We have an every other week meeting entitled the Consumer Focused Stakeholder Work Group, and then we have a former foster youth work group. These are some of the main opportunities that we sit down with advocates in some cases who are very focused on a specific population, but others where they're looking more broadly at some of the work that we're doing. We have been sharing with them both a detailed list of what each of the releases look like, and that to the extent that the design sessions are finished and that it kind of spells out how the design functionality is going to be constructed within the system, we're going to be sharing those documents as well. I think obviously the key to making any of the releases work in a timely manner is to allow that there be adequate testing within the network and on the ground with the counties. So I think we've built in a lot more time. So while people say, well, why can't we move it up? I think it also speaks to the fact that some releases are more complicated, some are linked to another piece. And so there was a great deal of coordination that had to go into how we move those things around. And obviously on a weekly and almost daily basis, I believe that Renee is in conversations with the counties, eligibility staff, as well as the design staff. And so we are endeavoring at all levels from top to bottom to make sure that we are consistently coordinating issues, that we're flagging things that need to be either prioritized or otherwise, have decisions made so that the design sessions can go on. To the question about the increased workload for county eligibility workers, I think that we have noted, and the administration last year through the budget certainly dedicated some resources to the fact that the system was not working as had been intended, and so that the counties were struggling, under just a really dramatic caseload growth that, of course, as Mary just testified to, we had no idea would be as significant, albeit successful. So we have both dedicated resources for the counties, but I know that we have continued to see some increased workload. And so the functionality of the system has also been, and the roadmap has been designed to try to ease some of those most imminent workload issues and to try to make sure that that works. We've also undertaken some batch processes at the state level to try to ease some of the workload down on the ground. And then lastly, how are we working with county eligibility workers? Again, we have a variety of different communications and meetings that we work through, but obviously our key partner in this is through the California Welfare Directors Association. They have really taken a lead, and I know work closely with Renee to kind of make sure that they coordinate responses from the counties in terms of the priorities that they're seeing and the issues that arise on a daily basis or a weekly basis with the system, especially if something's not working. And then we have weekly county operational calls specifically relating to CalHERS. And I know that we have meetings both at a department and an agency level with the various organizations that represent the county workers on a local level. So I think we try very hard to listen. If something's not working, then we're endeavoring to make a change. Lastly, the last question on your agenda was the optional demographic questions regarding sexual orientation and gender identity. I think that to the point that the administration has acknowledged that there's significant disparities in health among different subpopulations, and capturing the data, as Mary indicated earlier, when data is aggregated in a standardized format, it allows us either at a state or a county level to identify issues where there may be an access challenge or if there's a specific problem with the population. And so we are working both with the counties as well as the federal government, who's required to ask for some demographic information. I think we have settled on 3 questions that we are in discussions on regarding the sexual orientation and gender identity, that we are trying to find out where we put that in the overall application, because we want to also make sure it's a voluntary question. Individuals are not required to answer it, but we also don't want it to be a barrier or have anyone think that it's related to their eligibility. And so how we place it in the application is still what we're in the process of trying to figure out how it best works.
But there is a commitment to address it generally.
Yes, absolutely.
It's not the if, but the how.
It's not the if, it's the how.
Great.
And then to the CalHERS electronic trailer bill language, we are proposing that we remove the July 1, 2015 sunset date that's in the Welfare and Institutions Code. I think that, working with Covered California and CWDA, we all agree that the MAGI process, as was drafted, is working, and we're pleased with how it is. And it's our understanding that all 3 find this the way that the eligibility determinations, and that the county retains the final say in all of the county and the county work, and the case management resides with the counties. We are believing that this is something that we would like to just see removed out of the trailer bill.
And so the MAGI continues to be a challenge that I'm hearing, at least from advocates, that they're hoping that the department will continue to work with them to work through some of the MAGI challenges.
Okay.
Senator Stone.
Madam Chair, I regret that I've got to leave to catch a plane. And so if I can just make just a couple of comments on a couple of issues that are very important to me before I leave. Thank you for that opportunity. I just want to just briefly talk about Medi-Cal fees and Denti-Cal fees. I just want to be on the record here today, and I'm sorry I can't be here to hear the testimony, but I'm a strong supporter that we need to have higher Medi-Cal fees to providers, including dentists, physicians. We have a third of the state in the Medi-Cal system, and we have a lot of providers that can't even cover their costs with the Medi-Cal fees that are been used, and they've sustained, as you know, many cuts in the past that have not been fully restored. So I look forward to working with you, Madam Chairman, and our committee to ensure that our providers are paid appropriately so that we can have a comprehensive health care system. $98 billion and a third of the state in the Medi-Cal system, making sure that we have a provider network that provides for the kind of care that our citizens deserve and need. So I appreciate making those comments and look forward to our next meeting.
Thank you very much. Finance, LAO. We'll open it up for public comment. I'll ask you all to restrict your comments to 2 minutes maximum, please.
Thank you, Madam Chair and members. Kathy Sunderling with the County Welfare Directors Association. First off, we definitely appreciate the comments of Director Kent acknowledging the hard work that counties and particularly our frontline eligibility staff have done to get the 12 million people onto Medi-Cal, help them maintain their coverage, and work within the computer system, which has these acknowledged issues. We discussed this a couple of weeks ago, of course, and mentioned at that time that while the system is improving, there is still a significant amount of work to do. We have workers here today from Santa Clara and Los Angeles County who can speak to some of the more, specifics. Don't stand on the microphone, people. Sorry, sergeants. The key issues that we've seen are a lack of functionality, for example, the foster youth eligibility that's mentioned in the agenda, erroneous functionality or rules not being properly programmed, and then issues with the notices, as you know, from SB 1341, which we worked, Madam Chair, with you on last year regarding duplicate notices and notices that had issues with them. I think the huge caseloads in and of themselves would have certainly taxed our structure, our 15,000 eligibility workers, but coupled that with these issues in the new computer system, and what has resulted is a tremendous amount of manual work. We do very much appreciate our involvement at CWDA in the development of the 24-month roadmap. It's been a very good partnership, and it's a really good start. I think, as I mentioned last time, it's going to take a while. There's much to be done. It's going to take longer than just 24 months to get the system where we think it needs to be. And we do appreciate as well the governance changes that are discussed in the agenda and that were mentioned by Director Kent. As well, we're working on some things outside of the roadmap, such as implementation of recommendations from an organization called First Data that would allow us to expose the rules in a different way to our SAWS county computer systems and make sure that we're able to use those MAGI rules in a way that's more cleanly done and less beholden to the entire CalHERE system. We certainly would like everything to be done now. It would be great if it was done yesterday, but of course we have to be realistic about the timeframes, and we're working very closely to make sure that our priorities are taken into account as they have been up to this point, and that we're continuing to be at the table to make sure that these changes can be made. We appreciate your ongoing interest and oversight in the issue.
Thank you, ma'am. Next witness, 2 minutes, please.
Roseanne Berthrana-Rechka. I'm from SEIU representing eligibility workers. I'm actually a Medi-Cal program coordinator who does policy with overlapping into systems functionality to give information to staff. I would say that the failed interface issues between CalHERES and SAWS continues to cause serious delays to Californians in enrolling, such as what's been happening with the former foster care youth and other issues for the county. When we review the 24-month plan, it is just I think at the beginning, there's lots of things that don't work really well, and so we know that this will be going on for a while. One of the things that's disappointing to counties is that there is nothing slated for a unique identifier in the CalHERE system to prevent duplicate applications from being made. Right now, like if I was to log into my bank and try to create another account, it would say, Roseanne, we already know you, you can't do that, but CalHERES doesn't do that. You can we have seen up to 30 applications, which we have to sort through one by one to determine which application it is we're supposed to process. In last month, Santa Clara County alone got 6,206 duplicate applications. Over the next year, that's 74,472 if it was to be and remain at the same rate. And it takes approximately 45 minutes to sort through each one of the applications to figure out which one to even start to process. That's 55,000 man-hours in a year just sorting through duplicate applications. I'm not sure why someone would create 30 applications. We're hoping it's not fraud because someone gets paid $50 to help someone create an application, but really it would help counties tremendously if that was put in. Another one of the issues that in the interface is transactions between a SAW system and CalHERS get stuck when there is interface problems, when you have multiple systems doing. So we get an error report daily about that. I did a little weekly analysis on that error report and added up how many transactions we sent over to get Medi-Cal and how many were stuck. Nearly half of our transactions last week were stuck. 45.9% of times when an eligibility worker is trying to determine eligibility, it gets stuck. So then they begin all the various workarounds, some of them which are sanctions, some of which are I'm just trying to make the system work, I'm trying to do this, I'm trying to do that. So the amount of work it's taking county workers to try to get benefits to people who are needy and need medical assistance is monumental, and it doesn't look like it's going to stop anytime soon. The first data report gives a outline of a way to improve that, and we would like, as county eligibility staff, to be included in the decision-making of how to improve this, because we're the people actually using the system, doing the benefits, and we would like to be one of the stakeholders. Thank you for letting me.
Thank you very much. Could we just ask, if I could ask for some clarification,
Sure.
Perhaps from the department on the duplicate apps. Clearly they're not, because I get a little nervous when you use the F word. Clearly they're not going through the entire process, and that person who, the 30 applications, they weren't approved 30 times. But could that be a case where someone goes to an application assister, they don't finish, or they go on, they go online and start the process, don't finish, you start all over again? How do we get to a scenario where there are 30 applications?
Madam Chair, John Boulay from OSI. Yes, you're identifying some of the situations that could create a duplicate, and it's a great point that we're working with the IT department at the Department of Healthcare Services and actually piloting some master data management solutions right now to be able to reconcile the various direction that data could come into the system to be able to find out, do they have the right individual, and to be able to eliminate or reduce the amount of duplicates that then can be created through data analytics and using our data within the system better. So it is an issue, and that's what we're trying to address, to make sure that as people come in from various times, if they were stuck and weren't able to do it, come back in through an assister or something else like that, that how do we reconcile that data to find out what is a dead application, what is a duplicate application right up front. We've been DHCS has done some pilots with some vendors and have been working with our SAWS partners to be able to demonstrate that. And we're having some planning sessions on what are the next steps to be able to rectify that.
Okay. All right. Thank you. Appreciate the questions. Remember, ditto is accepted. 2 minutes. Thank you.
Elvia Malvito, Los Angeles County with SCIU. Referencing our concerns for workers, they were validated when the State commissioned a report to address the failures and shortcomings. The State commissioned this first data report that recommended a new option to improve the failed interface. We're happy that the state has agreed to work with the frontline workers in the development of this new option. The workers, of course, have the most meaningful feedback and the most useful insight for the most effective solutions. Until the interface is repaired, clients and workers are going to continue with the long delays and the manual workarounds. We are ready for the day when we can access the rules to process our clients' eligibility with the goal of making this a smoother function. As the state implements this new program, it's important that the state and legislature ensure that the state engage the employees, that we develop a definitive and clear timeline that manages expectations and promotes clear communication, and ensure that legislative oversight through an annual report to improve accountability. We agreed to work with the administration on this new option, and we're ready to start. We're excited for this partnership. And as a side note, I helped my boyfriend enroll in this program, and it took a great amount of self-control not to put in another application because I received no communication or information, and I work this program.
Right.
So I can understand.
All the duplicates happen.
Right.
All right, thank you very much. Appreciate that. Next witness, please, 2 minutes.
Madam Chair and members, Brian Allison on behalf of the American Federation of State, County, and Municipal Employees. We echo much of the concerns, and I think you've heard some of the issues that eligibility workers are having on the local level in properly implementing this program. We just want to reiterate that it's critically important that our line workers continue to be engaged in the process to improve the system. They are on the front lines, facing the frustration and the issues that folks in the community are having when they're trying to sign up for much needed services. So going forward, we would very much appreciate a greater partnership and role in determining fixes to the workarounds that our workers have to use to make the system functional to the public. So thank you so much for your time and your leadership on this issue.
Thank you very much. Next witness.
Elizabeth Landsberg with the Western Center on Law and Poverty, and we want to start by thanking the Department in Covered California for the changes made to the 24-month roadmap in the last week, specifically some of the eligibility functionality for former foster youth, different categories of pregnant women, some of the immigration and income rules. We do urge that we see if there's any way to move those up, because if you're one of the folks who is a former foster youth or falls within one of those income rules that has not yet been programmed, you are not getting the health care to which you are entitled. We appreciate Director Ken's accounting of the stakeholder groups, and it is true that those groups have met. However, I do have to respectfully say it's been a frustrating process in terms of input not being acted upon. We did just get these descriptions of the change requests in the 24-month roadmap last Friday evening. We will be submitting to DHCS and Covered California our feedback about them, and we really hope that there's a new table that's set that includes advocates in terms of decision making, because up to this point we've basically been told what's been happening, but we really want to have the we take Director Kent at her word. We appreciate that Ms. Richardson's here, and that both of them have stated their intent to be personally engaged with the issue. We do support adding the questions about sexual orientation, as we have urged be part of the application since 2013. It's news to us that there are 3 questions that have been written, so we'd be very interested to see those 3 questions. We've been recommending since 2013 2 specific questions, so we hope to again see that and be engaged in a much greater extent moving forward. Thank you.
Next witness.
Good morning. My name is Sarah Potter, and I'm here today representing Foster Club's Youth Ambassadors, a group of young leaders throughout California who are working to improve outcomes for children and youth in foster care. Like many foster youth, I entered care at 18 months old due to my parents' drug abuse, which resulted in domestic violence and then neglect. I remained in care for the next 17 years until finally emancipating at 18. As you can imagine, I was excited to learn that the Affordable Care Act would extend my health care coverage under Medi-Cal till age 26. I had been disenrolled at age 21 and found myself in graduate school with no health insurance. I went to the Covered California website to sign up under the new provision and was told that I did not qualify for Medi-Cal and would need to purchase a plan that cost several $100s a month. It took 4 visits to my local HHSA, multiple phone calls to the state foster care ombudsman's office, and countless hours over a 6-week period before I finally received the health insurance I was entitled to. While navigating the often confusing process, I recognize that many other foster youth were likely experiencing the same difficulties, but without resources like reliable transportation, internet access, and connections to supportive and knowledgeable adults. Because of these barriers, many foster youth are still unable to get healthcare coverage. I would like to encourage DHCS to make improvements throughout the entire application process to ensure that former foster youth like myself can enter through no wrong door when attempting to access the healthcare coverage they vitally need. Thank you.
Thank you very much. Next witness, 2 minutes.
Good morning. Jessica Haspel, Children Now. I just want to echo the comments that Sarah made. I think she really illustrates why this is such a big issue. And certainly we appreciate that the department has moved this up in the roadmap and appreciate that that feedback was taken. As Sarah indicated, we feel it's really critical, given the gravity of what the consequences are of the lack of programming, that that happened even sooner than September 2015. Sarah's case is unfortunately not an isolated example. We're hearing from former foster youth that are experiencing similar struggles getting into coverage, whether it's that exact same fact pattern or some variation. The fact of the matter is it's really an arduous process for them to get into coverage, and a lot of them are not even getting into the right program after applying through multiple channels. I think this is illustrated by the fact that we know that in looking at data on how many youth just in California have exited foster care at age 18 or older and are in the relevant age range of 18 to 26, there's approximately 39,000 of them. And yet, as of December 2014, we had less than 7,000 youth in the former foster youth program through Medi-Cal. There may be a variety of reasons for that, but certainly the programming piece is one of that, and it's, I think probably a big part of the puzzle. It's also affecting retention in that because of the interactions with the various systems, we've heard of certain youth that actually have gotten enrolled in the right program and then unbeknownst to them been kicked out of that program and moved into another one because there's interactions with the system. So I would, again, hope to see this moved up even sooner. We do appreciate that we've seen it moving in the right direction. And I would also encourage that there be additional workarounds. The workarounds that are in place now, it's helpful to have them, but there's a lot more in terms of workarounds that we feel are needed. Outreach only goes so far. When someone then goes, they know they're eligible for something, but they encounter the barrier at the time they actually try and apply. So I appreciate the attention to this subcommittee on this issue.
Thank you very much. 2 minutes, please. Next witness.
Good morning. Joe Michael with Equality California. We'd like to voice our support for DHCS to include voluntary questions about sexual orientation and gender identity in the paper and online applications for Covered California and Medi-Cal. We also would be very interested to see the 3 questions that the director mentioned and what the answers that would be available also would be. We'd really like to be a part of that conversation moving forward. We believe that this data is key to unlocking vital information about health disparities that we know impact lesbian, gay, bisexual, and transgender people, such as high rates of cancer, HIV, substance abuse, and mental health issues compared to non-LGBT people. This data has never been collected by state agencies, and we strongly believe that it is time. About a third of all Californians will be covered under these healthcare programs, as has been mentioned. So we have a unique opportunity to begin capturing this data and putting it to work to ensure better health outcomes for the LGBT community. That's very important to us. And if we are not counted, we do not count. Thank you.
Next witness.
Tam Ma with Health Access California, ditto the comments of my colleagues from Western Center, Children Now, EQCA, and also on behalf of the LGBT Health and Human Services Network, we also support including the sexual orientation and gender identity questions on the applications. And in addition to being a critical part of addressing health disparities in the LGBT community, this data will also help us evaluate whether all the investments that we're making in outreach and enrollment in Covered California and Medi-Cal and LGBT communities are actually working. Thank you.
Thank you. Next witness.
Harry Sanders with CPEN, also ditto the comments of Western Center and Children Now, and I really appreciate the changes that you've made in prioritizing the former foster youth and pregnant women by moving that up, and hope that you'll consider the additional workarounds and other suggestions of advocates to make sure that it's a smooth process. Overall, with the 24-month roadmap, as you're programming and automating notices, we also really hope that you'll be paying close attention to translating those notices and making sure that they're available in all the different languages. We noticed that immigrants will be getting notice if they fail to get through the federal data hub for citizenship status, and we know that many of them are limited English proficient, so it's especially important when you think about particular populations that will go through CalHERS. We also support the SOGI data inclusion and, look forward to working with you to make that a possibility. Thanks.
Thank you. Next witness.
Hi, Linda Liu with Young Invincibles. I'm here to speak on the issue of all of the young Californians who qualify for Medi-Cal but have experienced great challenges in actually enrolling. And so that's both the DACA population as well as the former foster youth population. And, I think that just to add to the comments of those who spoke before me, there is also this added problem of when I go and I encounter a problem enrolling, and then it takes me 4 times going to different offices to try, I'm going to go tell my friends, oh man, it took me like 6 months and I had to go to these offices 4 times, and we're going to compound the problem of people not enrolling because they're not even going to try.
Right.
So I also appreciate, while I appreciate that it has been moved up in the 24-month roadmap, would really appreciate further attention to the workarounds, or if possible, moving it up even further. And also want to echo the comments about sexual orientation and gender identity questions. Thank you.
Michelle Stolver-Vensky, Children's Defense Fund, California, also here on behalf of the Children's Health Coverage Coalition, which includes the Children's Partnership, Children Now, California Coverage and Health Initiatives, United Ways of California, and PICO California. I want to echo the comments that we've heard on the importance of protecting and ensuring that the vulnerable population of former foster youth don't fall through the cracks and are able to enroll, and encourage looking into any possibilities of moving that time schedule up even further, and also echoing the comments of Western Center on Law and Poverty in terms of the need to incorporate advocates into the decision-making process. Thank you.
Thank you. You know, I would just say that I heard a number of the members of the public talk about wanting to move the foster youth and the AIM issue up quicker on the 24-month roadmap. But I would just say that I also don't want to be in a position where it's moved up so quickly it's not done right or well. I appreciate many of the challenges you experience with the program. It's a little like turning the QE2. You can't just turn it in one fell swoop. And it takes a minute. And so, you know, I would again implore you to find the balance between expediting it, because we don't want to continue to lose access for very vulnerable populations, but it's got to be done well, because we don't want to go back and have to, you know, do additional fixes. So move it up, but make sure it's right.